Speaking of new businesses,
Yes.
we have a new member here today called Fyzical Therapy and Balance Center. I want to welcome Garfield Drummond, the general manager there. And how fun is it? Fyzical is Fyzical. It's so cool. At first, when I was reading his shirt, I was like, physical. Oh, look at that, you know. So welcome, Garfield.
Thanks for having me.
Yes. So what is Fyzical Therapy and Balance Center?
So Fyzical Therapy and Balance Centers is an outpatient physical therapy clinic. We've been in the franchise business for about 10 years, with about 575 locations around the country.
Wow.
It's a pretty massive system. The majority of those are franchisee owned, but there are about 60 plus corporate owned units that are in, I want to say 22 states or so.
Oh, wow.
Owners range from actually practicing PTs to individuals like myself that I'm not a PT. I'm a business owner, an entrepreneur, but you find a wide variety of personalities involved in this business.
And so so you just started this franchise in the Waltham area. What is your service area for?
Yes, we recently opened. Our soft opening date was May 28th.
Okay.
So we're about close to 2 months in operation at this point, month and a half. It's been phenomenal over that period. We are in Waltham at 187 Lexington. So our general territory, when you think about a physical therapy practice, we usually draw a radius of, say, 2 miles or 22 minutes as the drive time that you look for a physical therapy practice.
Although, however, I know it's extremely hard to get into like a physical therapy to get an appointment when it's attached to like a hospital or something. So you see, what are your services that are offered, I guess is the better question.
Yeah, to your point, getting into any physical therapy practice can generally be months at a time, right? You're on a wait list to get in, and especially after a surgery event.
Right.
You've had shoulder surgery or knee surgery, and it's really difficult to get into those practices. We're hopefully trying to alleviate some of that bottlenecking that's happening. We do provide the full suite of orthopedic, sports rehab, neuro rehab, but we add in our balanced paradigm, our balanced therapy programs, which really separates us from most of the other practices that you'll see in town and just around in general. That being, just balanced therapy.
Do you want to get into that a little more?
Yeah,
So
sure.
because I know I have terrible balance, and I'm always like just trying to. And I think as you get older, you have like not great balance.
Right.
Is that? I mean,
Absolutely.
that's a thing. I think, right?
We talked about it because I was actually, when I met Garfield, I was telling him about my father who lost his balance recently, and then when falling, he hurt his knee, and then he hurt other things, and so. Then it's like, okay, do you go for the knee? Do you go for the balance? Do you go for what? But so we talked about that, which I'll ask you. And also, I have really bad vertigo. So that's a specialty that you guys do as well. So if you can touch base on both of those, that would be great.
Yeah, so we have a robust balanced paradigm, science-based paradigm that our therapists are trained in. They have special training in that they can get up to 3 levels of training that makes them an expert in balance therapy. And so they're able to administer a really robust systematic program to address whether it's vertigo or general dizziness or assistance with another part of your body that you're recovering from, knee surgery, hip surgery. We do this in our facilities that have a safety overhead harness system. That's one of the key components of our program. So all of our patients are connected to a harness system and connected to an overhead track.
So they don't have to fear that they will fall.
Gotcha.
Yeah.
So we're able to be a little more aggressive with the therapy program. We push you to your limits without you having the fear of falling and injuring yourself. or injuring our therapists.
Yeah, no, and I know as you get older, falls are a lot more dangerous to older adults. Is that correct?
Yeah, so the CDC has a stat. 1 in 4 seniors 65 and older are going to fall. And that increases
say that
with
one
age.
more time?
Yeah.
1 in 4, 25%
Wow.
of seniors are going to fall.
Wow, that's a lot.
The cost to the healthcare system in 2015 was about $50 billion with a B from falls.
From falls.
From falls.
50 billion from falls.
Yeah, so it's a major concern that
Yeah.
needs to be addressed.
Yeah, and preventative
So,
medicine.
I was gonna say,
Yeah.
you know, how would one, quote unquote, fall-proof their home?
So a lot of different ways, right? Most simplest way, and obviously every home is different. Your conditions are going to be different than your neighbors. You know, remove trip hazards.
Rugs.
Cords that are laying around, those throw rugs that might trip you up.
Okay.
Furniture that might be too close to you. You want to kind of create that environment that you can walk freely throughout your home. Night lights are helpful. And you know, one of the simple things we try to talk to patients about, it's when you're waking up in the middle of the night or taking a nap in the middle of the afternoon, right? Give yourself a moment to reorient yourself with your surroundings before you start moving.
That is like the best advice ever. 'Cause,
Why, sorry, I'm going back to the 25%, but why do you think that it's that high of a percentage of people falling when they get older?
Just injury-related issues, age-related issues, your reaction time diminishes as you get older.
Okay.
And so that's part of what our balanced therapy program targets. We identify what your specific challenges are, what your weaknesses are, and then develop a program that's going to help to rebuild that weakness.
Which is, you know, truly like that kind of seems like it might be the basis of physical therapy, you know, rebuilding those muscles that, or the, you know, the part of your body that was injured, and just like getting it back up to full range of motion or full strength and stuff. And so that's why physical therapy is key. Although, not gonna lie, I kind of hated doing physical therapy when I've fallen or something like that.
But it's a necessary evil, right?
It really, truly is.
And you know, part of our programming, we try to get beyond just the injury rehab, injury recovery. We try to incorporate the preventative programs, right? The strength training, the conditioning, so that you don't fall, right? So that if you're falling, you're able to, your reaction time improves. And so, yeah, you may hit the floor, but you'll hit it
in a gentler way.
Generally, and that's the goal.
So I think, and not to speak for you, but the hardest part about physical therapy is not that you hate physical therapy, it's the actual, you have to put in work, and it's like, it's not
So we determined that I'm lazy,
done.
so
no, it's not a one and done. You know, you go to the doctors and they're like, here's medicine, you're done, right? But physical therapy is you have to
put the work
proceed
But
to
not
go
only at
on
the
a
appointment,
regular.
you have to do it at home, and you have to, I mean, because you're not going to get better if you don't.
Yeah,
and
you know,
I think that is really challenging for people, but like it's necessary to be able to heal properly. We just choose to be lazy. So.
you know, our motto, you know, the physical, you know, spelled Fyzical, our motto is love your life, right? And we incorporate the love your life mantra into everything we do. And so that begins from the time our therapist meets with the patient and they develop a collaborative plan of care that's going to result in that patient getting back to the things they love to do. And so if you have that as your objective, you can implement a program that you will commit to and that you will actually do work to achieve.
So now, do you need a physician's referral to go to physical, or?
No, actually, and for any physical therapy practice, not just our clinics. Massachusetts is what's known as an open access state.
Okay.
And so what that means is any one of us, we can walk into a physical therapist's office and begin treatment I've got a lower back injury. I can't get in to see my primary care. I know I have a lower back injury and physical therapy can help me. You can go to a physical therapist, they can begin treatment, and they will work with your primary care, again, depending on your specific insurance.
I was going to ask, you do take insurance?
We do take all the major insurance, Medicare.
Okay.
Depending on that specific insurance, you may have to submit additional paperwork, but that clinic will work with those payers as well as those providers.
So you know what's funny? I'm thinking about this, putting in the work, right? So you go to a gym or you subscribe to like a lifestyle change, right?
Yeah.
And like you pay monthly for that.
Yes, you do.
It's not covered by insurance.
Nope.
It's so that you can have a better life.
Yes.
You can strengthen your like body and possibly lose weight. That's the objective. But mind you, you go to physical therapy, you're literally doing all of that minus the monthly fee.
Yeah.
But yet we don't want to put in the work for physical therapy to heal ourselves, but we'd pay for a gym subscription? Like that, how does that make sense?
To get customized treatment from a physical therapist.
How does that make sense?
When you put it that way.
Yeah, you're welcome, people. Go to physical therapy. Yes.
Go see our friend Garfield because
That's absolutely right.
Yeah.
If you think about it, the healthier you are because you're going through physical therapy, the more you're going to love your life, which is kind of how gyms sell it. It's like, hey, you want to lose the weight or you want to get healthy, you can enjoy your life more if your back doesn't hurt all the time, and here's how you strengthen your back at a gym or a lifestyle place where you could do it at physical therapy.
Yeah, where you have clinicians that can help you through it.
Yes, licensed clinicians.
Licensed clinicians.
And partially paid for by insurance.
Yeah.
Where if you go to a gym, you don't get...
So we've just... Next world peace, we're gonna talk.
I know. But sorry, like that's how my brain. This is the ADHD people. Which, by the way, this is as some of you may have noticed through our conversations here, and anybody who watches this probably knows that I have what we call an ADHD, which does not necessarily mean what, but it's a conversation thing. There's a lot that happens, but sometimes when you do see a squirrel, you get distracted.
Correct.
Right?
Yes.
That's not all that ADHD is, but it is.
Yes.
It's like, a squirrel. My friend Garfield over here has recognized that. Can you talk about your squirrel in the office? Because I found this to be so fascinating.
My staff and I, my therapist and our CCS team, we're often having meetings together, and to your point, Melina, we get distracted. We're on topic A, and all of a sudden topic B and C shows its ugly head, and we start focusing on B and C. So we've developed the squirrel talk, and we actually have a stuffed squirrel that we'll throw around to announce we're getting off track, squirrel, and that just gets us right back
Oh my
on
gosh, I
track.
love that.
You could use that in some board meetings and stuff. That would be really kind of
absolutely.
The only challenge is if everybody in my life had a squirrel for all the times that I went off topic, I would just be pegged with a squirrel all day, every day, and I'd be like, squirrel, squirrel,
But you
squirrel,
would
squirrel.
be amazed at how it really refocuses your energy and your ideas, and you're back on track, and you're then able to really stick to the plan and work the plan
Because someone
out.
called you out.
Yeah. No one likes getting called out, right?
So can
That's
you
so
actually?
funny.
So now tell us how many people are in your staff and or at your facility.
So we are, like I said earlier, we're almost 2 months open.
Yep.
I've got one full-time therapist. We're actually a hiring, so if there are any physical therapists out there, give us a call. We'd love to sit and chat with you. When we are fully ramped out, we expect to have 4, maybe 5 therapists working out of that operation, along with 3 or 4 support staff to help that team.
Wow. And you talked about your soft opening, which was 2 months ago. We are, the Chamber and Physical Therapy and Balance Center, will be having a ribbon cutting in September.
Yes.
We will keep you posted on that. I believe that you sent some photos in to show. Did you send some photos in?
I did send some photos. I'm not sure if they're up on the prompt yet, but we'll have some photos.
So is your
I think I
facility
also have
completely
photos.
built out? Is it?
Yes.
Wow.
Facility is completely built. All the graphics are up. We're at 187 Lexington St, adjacent to the police department. and fire
Okay.
department
Okay.
on Lexington. So you'll see our signage. We go around in these bright colors all the
Yeah.
time.
You said you're close to Quick and Clean, right?
Yes, there's
Yeah.
a car wash.
Yeah.
We're between Quick and Clean and
And-
the fire department.
Which
Okay.
is awesome. You can go and get physical therapy and
then-
car detailed from both of our members. Listen,
There we go.
yeah,
That part of Lexington
Yeah.
Street is
Yeah.
is quite the
It's a bustling
Yeah.
strip.
yeah.
it's pretty fun.
That's awesome. And so phone number. How do people actually get a hold of
Physical.
of-
So you
yeah.
can find us on our website.
Okay.
Fyzical.com/Waltham MA. That's physical, FYZICAL.
You can go to the chamber.
You can go
Oh,
to the chamber.
right,
Yeah.
right.
Our phone number is 781-390-3111.
Oh,
Okay.
good number.
So I have a question when we were talking about multiple injuries. So for instance, my dad fell over, he hurt his knee, but we're also trying to figure out the balance. How is it that you work through that? Do you focus on one thing at a time? Is it, at each appointment you do a part of this, a part of this, a part of this, or like whole heart? Like how do you?
Yeah,
what do you focus on?
it is a whole body approach. So if your father came in, he'd obviously sit with our therapist, and she's going to put him through a regimen of procedures to understand what the challenge is and where the assistance is needed. Now, obviously, he's coming in primarily for his knee, but we are going to do the whole body. We're going to look at the whole body, and we're going to try to incorporate as much of the balance program into that knee recovery so that that knee is resolved in the best manner possible. Balance is critical to every system in our bodies, and so if we can incorporate that into your knee rehab, your hip rehab, your ankle rehab, we find that to be far more successful than simply just sitting down and doing knee exercises
Right.
and not incorporating and thinking about the whole body as
Wonderful.
part of that recovery.
And I need to thank you for giving us a little goodie bag. As you can see, I'm using a new pen, which I love. I love getting pens. But what do we have? We have a little T-shirt here. Thank
yeah.
you. Look at this, Cal.
Yeah.
So welcome.
Isn't that
Oh, I love
fun?
it. So, yeah.
we're going to be repping the nice blue bright color as well. So thank you so much for this. We really appreciate it. Is there anything else you want to tell us?
Well, again, one of the things, I gave you our address. We're at 187 Lexington Street.
Yep.
In Waltham. One of the other things that we do that you don't find in a lot of other physical therapy practices is the one-on-one treatment. So when you're with us, it's you and our therapist. It's not you, another patient, maybe a third patient,
Yeah.
and that one therapist.
Yeah.
Okay.
We believe that that's the approach that works best. It fosters that collaborative nature between you and the therapist to really resolve the issue that you're with us to take care of.
Yeah. And your turnaround if somebody was calling for a referral or walking in.
Yeah, we do take walk-ins.
Yep.
Generally, we can see you that day, if not the next day.
Wow.
Okay. Wow.
That's
So
amazing.
give us a call.
And you're still, so don't forget, he's still looking for 3 more therapists? 2 or 3 more?
I'm looking for 2 or 3 more therapists.
2 or 3 more therapists. So if you are in the field or you know somebody that's in the field, please give Garfield a call, or you can reach out to the chamber and we can give you the information. Garfield, thank you so much for joining the chamber, and thank you for being here today and explaining all of this. And hopefully Kelly and I can balance our life a little better.
Well, we
And-
can help you with that if
yes.
you need.
All right.
But thank you for having me.
Thank you.
Thank you.